His daughter was diagnosed with inflammatory bowel disease at age 12, and she had skin problems like eczema, but they're now all gone. This is the journey of my latest client who overcame inflammatory bowel disease and eczema using the mind-gut immunity method. Hi, I'm Dr. Dasari, and I'm excited to announce that we're now in our 12th year with a global presence. We've supported clients in every time zone worldwide and in all age groups, helping them to successfully manage gut inflammation and autoimmune disease without medication. To learn more about our method, visit mgiclinic.com and request a call. We also have important updates for 2025, 2026, and beyond based on our latest research on IBD. Our protocols are constantly evolving to ensure the best outcomes. This information has the power to transform lives, so come check out and see what we have to offer. Here, we have a parent of a young client who is just 12 years old. She had eczema and inflammatory bowel disease. She was able to fix both problems using the mind-gut immunity method. It's always stressful for a parent to see their child go through something like this, seeing their kids suffer. So there are a lot of important takeaways from this. So I really wanted to talk to you about the experience of having a child with inflammatory bowel disease, with Crohn's, because your daughter was, how old was she when she was diagnosed? Very young, right?
Plus,
12,
to
yeah.
14. Yeah.
And she had the symptoms for almost a year by the time she started, or more than a year, like slightly more than a year when she started with
Yeah.
the program.
It might be, I would say, like the core symptoms related to her anemic condition and everything, like maybe 6 to 8 months.
Mm-hmm.
But if I go all the way back, she had ankle pain and all these issues with her skin and everything all the way from like 5 years now.
5 years.
Yeah,
Wow.
4 to 5 years. Like, but it's nothing related to gut at that point of time. No one has diagnosed. It could be related to inflammation. But now I could recall after this program, we were we reversed everything. Her skin rash conditions is gone, eczema is gone, and her ankle pain is gone, and everything is gone. So now I can relate that to this inflammation.
Yeah. In our program, there's a lot of people that sign up with inflammatory bowel disease, Crohn's, ulcerative colitis, but we also have a lot of people with other autoimmune conditions, including things like eczema, so high histamine levels, all the histamine-related allergy conditions. So this protocol, as you've seen, also works for all types of autoimmune diseases, which is really cool. I wanted to ask you, I know your daughter was seeing a lot of specialists, high-level specialists, doctors. What were they telling you about her condition? Was there any discussion about nutrition, digestion, sleep, stress, exercise? Was there any discussion about that? And what were they saying about what needed to be done?
So the only option I've got is like if she has issues with the gut, absorbing the nutrition, and nothing else whatsoever you said, like stress, sleep, nothing of that sort of discussions happened.
Mm-hmm.
The only advice we have got is to go with the steroids to reduce inflammation
Steroids.
and
Steroids and biologics, right?
biologics to maintain it.
Yeah. And that's kind of, and then, yeah, I know it's really frustrating because you know that this condition, I mean, now, obviously she's been symptom free. She's like a normal girl at school, right?
Yep.
So,
Oh
uh,
yes.
how fast did her symptoms improve since joining the program?
4 weeks we have seen the improvement, and 6 weeks I should say the symptoms are gone.
Gone. So near 100% resolution of symptoms within 6 weeks.
Oh
That's,
yes.
yeah, that's a pretty good time frame. And I know during this time we were also working on improving her nutrition and improving her muscle strength and endurance. Sounds like she's now in athletics at school, right?
Yes, she is.
Which is good. That's really good. What would you say was the most helpful part of this program in terms of helping to resolve her symptoms?
I would say the very first thing I heard before signing up is warning us like this program only works if you adhere to the protocol, the
Mhm.
strict diet regime. Like without any diet regime would be easy.
Yeah,
But
especially with the
after looking at the
teenage, especially with a teenage girl at home.
yes, yes,
Right.
yes.
Yeah.
Like I haven't realized at that point of time my girl would support this program more. Like looking at it, looking at the diet program, I stepped back. Is it even possible? But
Yeah,
she proved me wrong by making it possible. So far, I can proudly say she was not she didn't even cheat for a day for like
that's
6 months now.
that's amazing. And
Yeah.
our biggest, I think I told you when I spoke to you on the phone, our biggest struggle in that age group, right, that young adult age group, is it's very hard to convince a teenager to do something unless they want to do it. If they
Oh
want
yes.
to do it, they'll do it. But if it's coming from their parents or someone else, it's not going to happen, right?
Yeah. Yeah. So I think the major motivation that she had was the reduction in symptoms.
Mm-hmm.
She has seen, I don't know if I can say, considering other patients that I've known after that, she did not see the worst, but to what she has seen, that is the worst. She
Yeah.
did not like that experience. So now, once that relieved from her experience, I think that is the most probable thing to motivate her to continue this regime without complaining at this moment of time.
Yeah. And she did really good. She did excellent. I'm very happy.
Yes.
Um, what advice would you give to another parent, let's say, of a child with Crohn's disease or any other autoimmune condition like eczema or some other thing that they're dealing with? What advice would you give them?
I think get the diagnosis as early as possible and start a program like this as soon as possible so that we can help the kids to get out of the situation and continue their life.
Mhm.
Yeah.
And as a parent, what are you looking forward to the most now that your daughter is basically symptom free, no signs of disease? What are you looking forward to the most? What is your daughter looking forward to the most? Maybe you're able to touch on that too.
Oh yes, absolutely. Like, and we very much like, the most time we think about is like, why didn't we know about this nutrition information uh, before? Is the first thing I have, yeah,
Oh, are you there?
yeah, I'm here. I'm here. Like, there is an issue on my computer. My
Okay.
video camera failed.
Oh, it's okay.
Yeah. So the most thing that I liked about, can you repeat the question, please?
I said, what are you looking forward to the most as a parent, now that your child is well? And
Yeah.
then I guess the other second part of that question is your daughter, she's teenager, she's in high school, she's doing sports. What has she told you she's looking forward to the most now that she's symptom free?
So the most thing that we are looking forward is to get all her blood reports back to normal.
Mhm.
So right now we have seen substantial evidence from her blood work in between, like 1 month before, 1.5 months before,
Yeah.
her numbers have came up really down. So
Yeah.
I'm looking forward to almost get them to normal
Mhm.
and have no and reduce the inflammation in her gut. Maybe we can, I don't know when we can get to the scope, have scope done and see how her gut has healed.
Mhm. Mhm.
Yeah.
That's great. And I know she's really enjoying her life a lot more now than she was before.
Absolutely. She has a lot of energy.
Yeah.
So can't complain, like compared to what she had before. Now she's full of energy. She was even saying like she was most of her school friends, like when she used to take a lot of breaks when she was playing.
Yeah.
And some people were not happy about that. And kids always complain, oh, you always complain, you'll have less energy. Now that's not the case.
Yeah.
She beats up everyone, like in terms of playing, running, everything. Like she's back to her normal.
That's great. She's probably also not as fatigued anymore. Anemia
Not at all.
anemia
Not
has
at all.
improved, her strength has improved. So a lot of these things have gotten better. That's great.
All right, that's the end. If you think this video will help someone you know, be sure to share the link with him. Leave a comment below discussing your experience dealing with gut inflammation and autoimmune disease and some of the challenges you're facing. Also, if you can follow for more content, it helps this channel reach more viewers. As always, it's Dr. Chanu Dasari with Mind Gut Immunity Clinic, and I'll see you next time.